Hi, I'm Bogdan Lakotiy and I'm applying for the Diagnostic Ultrasound program at Bellevue College with a specialization in vascular sonography. What interests me the most in becoming a sonographer is not only the ability to treat patients, which I find the most satisfying and life-fulfilling, but it is in the way that it is done. When researching various fields of healthcare, what drew me to sonography in particular, aside from it being safe, non-invasive, and low exposure, is the fact that it requires problem solving and attention to detail on a daily basis. Not only would I be fortunate enough to work with some of the most advanced technology in the world, but I'd have a chance to get a deeper look into one of the most advanced machines, the human body. In addition to these two skills and traits required for sonography, being able to treat patients and contribute to saving lives is something I'm passionate about and would love to do. In 2019, following my final season of basketball, I became interested in joining healthcare. With no prior experience, I wasn't quite sure what to do and which avenue to head in. That's when my grandpa had suggested working at a nearby retirement home and geriatric care facility, Wesley Homes. I applied, was interviewed, and was fortunate enough to be hired and accepted. Among all of the facilities on campus, I was able to be placed in the healthcare facility where I worked alongside several nurses, doctors, and physical therapists, all in the effort of contributing to the well-being and health of our patients. I was personally tasked with the role of serving patients food, and this involved me making sure that paperwork was being followed closely, that diets were being upheld, and that patients were avoiding any foods that could trigger any allergic reactions or cause any sorts of issues. During my time, patients would oftentimes give me a hard time because I wouldn't let them eat a certain type of food or dessert, but I believe that at the end of the day, that they understood that we were just trying to do what was best for them and their health. During my time at Wesley Homes, I really began contemplating what field of healthcare was best for me. I contemplated between nursing, physical therapy, and even becoming a doctor. Among all of the specialties that there are in fields of healthcare, I eventually decided to pursue sonography. And one of the biggest contributing factors to me deciding to pursue sonography was because of the opportunity I had to shadow vascular sonographer Christina Soltis. Shadowing Soltis, I was really encouraged by her ability to comfort patients amid their worries and really communicate well between her and her coworkers, all while maintaining a professional attitude and staying on top of her work, completing her paperwork properly, sending it off, and completing the entire imaging process and scanning process effectively and professionally. This is something that really encouraged me, and I was very impressed, and I really enjoyed having the chance to see her in action and see what she did, and that really encouraged me even more to pursue sonography, and it really solidified my decision. In terms of my experience with sick and dying patients, that ties directly with my experience at Wesley Homes. When I was first interviewed at Wesley Homes, one of the very first questions that I was asked was how I responded to death, and whether I was prepared to see a patient one moment and not a few weeks or months later. This is something I really began contemplating and questioning if I was really prepared for. And during my time at Wesley Homes, I really was tested. There were a number of patients who I would get close to. I would learn a lot about them and their life, and we would have many discussions, and then there came a point when they would leave this life. And this was very difficult at me at times, and I really questioned if I could handle it, but I was actually really reinforced to pursue healthcare, and it really encouraged me to embrace every single moment with our patients. I really admire a position as a healthcare provider because some of the moments spent with patients are some of the most valuable and precious, because during these moments when people are struggling the most or very worried or anxious about what may happen to their bodies and their health and in their life in general, healthcare providers have the opportunity to really comfort them and encourage them and uplift them during these times. Personally, I've experienced a number of injuries where I had dealt with very difficult times in my life and questioned my purpose and identity, but during these times I encountered a number of healthcare providers and physical therapists and osteopathic physicians who really uplifted me and really helped me stay strong during these difficult times, and that's a big reason why I've decided to pursue sonography. When it comes to the three specialties of sonography, ranging from general to cardiac to vascular, all three are similar. The technology used among the three specialties are very similar in their physics and imaging properties. In all three specialties, utmost care of the patient is to be demonstrated, all while working towards bringing the healthcare provider closer to diagnosis. In the three specialties, they are very technologically dependent, which means that the responsibility that lies on the hands of sonographers has a direct impact on patients' lives. Although the three specialties are very similar, they share different goals. Looking at cardiac and vascular sonography, they oftentimes implement and incorporate more math and physics into their imaging process and oftentimes have more opportunities to work alongside surgeons. General sonography has diverse exams with a broader focus on organs and incidental findings. With vascular sonography, those scans range from head to toe. The primary focus is on veins in the arterial system and hemodynamics, and can oftentimes be more ergonomically taxing due to the wide array of scanning from head to toe. In terms of cardiac sonography, though the surface area of imaging is limited, the weight of responsibility is not. And although a majority of scanning is done on the heart with a complex and vital organ. Among the specialties, I have personally decided to pursue vascular sonography. And one of the biggest reasons why I have decided to pursue vascular sonography is because I'm very fascinated by the arterial system and how scans do range from head to toe, and the fact that the arterial system can be so different in many areas of the body. And this is something that fascinates me a lot, and also because the field of vascular sonography is a growing field with a growing number of treatments, and there are so many opportunities to work alongside surgeons, which is very fascinating to me and something I'm really interested in, and a big reason why I've decided to pursue vascular sonography in particular. And one of the biggest challenges that I believe I will face as a vascular sonographer, aside from the ergonomic tax on my body as a 6'2" person, I believe that it'll be very difficult at times dealing with patients who have experienced very difficult moments in their lives, whether they may have experienced strokes or other events leading them up to this point. During my time shadowing Soltis, although I won't go too deep into details, there was a patient who had come in, and it was pretty disheartening to see the experience that they had gone through and hearing their story and what they had experienced with their health. But my time at Wesley really does reinforce my desire to pursue healthcare, and the fact that I really do feel prepared for these moments, because I've seen patients experience so many difficult moments, but I really admire the fact that healthcare providers have the opportunity to really embrace these moments and encourage patients and really uplift them during these moments. Despite what may be difficult in the field of vascular sonography and what I may encounter in life and in sonography in my career, I am very encouraged by the future, and I'm really excited for what the future holds, and I really do hope that I have the opportunity to further my education at Bellevue College. Thank you so much.